Friends, with this video, I will be demonstrating a technique to repair a radial tear of the lateral meniscus. Here we can see that there is a lateral meniscus body radial tear with both of the edges retracted on either side. The best technique in this particular circumstance is to do a side-to-side repair. Here I will be demonstrating a technique which is called as a box stitch technique to do a side by side repair of the meniscus. We must understand that we should have a straight trajectory. So what I will do here is I will be using a knee scorpion for the posterior horn of the lateral meniscus, and I'll be using curved spinal needles for the anterior horn of the spinal needle, and I will be passing sutures on both the sides and tying them in the end. So what this will do is this will make my surgical pattern easy. So just like as we do a margin convergence in a rotator cuff tear repair, here also we are performing by the same technique. We are using a nitinol chia wire to pass the suture through the anterior horn, and passing them sequentially will lead to a very good construct through which we can repair the meniscus. Here we can see that there is a significant gap of around a centimeter prior to the repair, and once we are starting the repair we will be able to approximate the meniscus, both the meniscus portions together, and not only we are able to approximate both of the edges together, but also we are able to retain or regain the meniscus tension on the lateral side. So this technique will actually regain the tension. So once we are through with the repair, you can appreciate that the meniscus continuity is maintained, the meniscus tension is maintained, and you will see almost a normal sort of a lateral meniscus after the repair is done. Now this sort of repair is not possible with the conventional all inside devices because they will push the meniscus outside, whereas with this technique we are pushing both of the two cut edges together towards each other. So friends, if you have any questions regarding this particular technique, you can WhatsApp your questions on the number. So here we can see that very nice final repair is obtained after all the three stitches. The important thing here is once we repair it, we should increase the vascularity and increase the biology by doing a microfracture in the notch. So once we are done with our meniscus repair, we should do the microfractures in the notch, so and that will increase the healing potential per se of the tissue. So here when you put small microfractures into the knee, it will